Depletion of blood oxygen may come as a result of inhaling nail polish removers, varnishes, or paints. Brain and lung hypoxia may center as a common symptom of any kind of inhalant abuse. Depletion of myelin protecting nerve fibers also occurs as a result of inhalants abuse. Inhalant treatment focuses on dealing with intense withdrawal symptoms, preventing relapse, reducing tolerance, and establishing psychosocial rehabilitation of the addict. 4.2 Behavioral addiction. Behavioral science experts pose that any activity which can potentially stimulate a person can truly turn up to be addictive. The development of such addiction begins when a normal social action transcends into obligatory behavior. The idea of addiction in absence of any psychotropic drug or chemical substances was introduced by Peel, 1979. According to Peel, absence of any psychotropic drug or chemical substances was introduced by Peel, 1979. According to Peel, an addict is primarily dependent on particular set of notion and experiences to which response to a specific psychotropic substance may be just an example. Behavioral addiction is different than substance addiction in a way that no substance is ingested by the body. However, the person gets addicted to certain set of behavioral responses. The examples would include gambling, eating, or exercise. Behavioral addiction was recently included in two main classification systems of DSM-IV and ICD-10, which emphasizes on functional impairments to be essentially present in occupational, interpersonal, and social areas. Other characteristics as defined by Goodman, 1990 should be present for at least 1 month and include persistent uncontrollable impulse to engage in specified behavior, increasing anxiety before the initiation of behavior, relief after engaging in. Psychology paper number 1, Cognitive Science. Behavior, a sense of uncontrollability and inability to stop the behavior. The most common types of behavioral addiction have been mentioned. 4.2.1 Gambling addiction, also understood as compulsive gambling, is a dysfunction related to impulse control. It is a preoccupation with gambling content irrespective of the financial, vocational, or relationship losses. Some of the serious problems that this type of addiction poses is that gamblers tend to gamble secretively and also in the absence of the required resources. They have trouble controlling the impulse and it becomes a major cause of worry for the family and significant others. Treatment for such gambling has to be extremely customized for each of the unique patients. Cognitive behavioral therapy serves as the best modality in association with family therapy. It aims to restructure the underlying dysfunctional beliefs, help the patient deal with painful emotion, develop stress coping strategies, and resolve deep-seated interpersonal problems. 4.2.2 Food addiction, as also known as compulsive overeating, uses food to deal with uncomfortable and painful emotions. It is very similar to any kind of drug or alcohol addiction where chemical reaction in the brain is triggered by a food item rather than any substance. This type of addiction manifests in having uncontrollable urges or cravings for a particular food item or a specific amount of food. As in alcohol or any other substance, after the consumption, individual feels a high which in turn reinforces the person to consume more of the substance. Similarly, in case of food addiction, consumption of specific type of food, commonly sugar, chocolates, or rich in carbohydrates, give an emotional high and maintains the vicious cycle of addiction. The broad symptoms of this particular addiction involves inability to control craving for a type of food item or the amount, consuming the amount till feeling uncomfortable full, eating food secretively, feeling guilty after eating but yet helpless in controlling, eating when not hungry, excessive concern or worry for a food item craved to be absent or in less than desired amount. In all, food addiction impacts physical, social, psychological, and emotional well-being of the individual. 4.2.3 Sex addiction. The main feature of this type of addiction involves an intense need to take part in the sexual activity. This uncontrollable urge may get instigated by watching many hours of pornography. This may further urge the person to have instant sexual gratification either by masturbating or by engaging into a sexual act online or at public places as well. Such promiscuous activity can lead to physical and psychological harm to the individual. The major symptoms of sexual addiction involves compulsive masturbation, large collection of sexual material, investing lot of time in watching pornography, engaging in sex with multiple partners, spending lot of money in prostitution, voyeurism or watching others having sex, engaging in rape or molestation, engaging in cybersex, having multiple one-night stands, etc. Another characteristic feature of this unique type of addiction is that individual experiences a lack of bond with partner involved and treats her as a sexual object. The consequences of addiction involve financial losses as lot of money is involved in prostitution, health compromises as many of the addicts suffer with STDs or AIDS, emotional pain of feeling helpless with addiction associated with guilt, social deterioration and poor social interactions. 4.2.4 Internet addiction. The increasing engagement with the virtual world and the real world has been a cause of concern for almost everybody. The use of internet can be constructive and destructive as well. It may seriously interfere with everyday functioning, work and social relationships. Internet addiction involves various forms such as cybersex addiction, net. Psychology paper number 1, Cognitive Science. Compulsions, maintaining cyber relationships, over-engaging in internet gaming, etc. The symptoms of internet addiction include no track of time invested on use of internet, inability to prioritize work and reduced work productivity, decrease in social interactions, poor occupational functioning, feeling of guilt for irrational behavior, feeling of anxiety before engaging in the activity and relief while continuing it. Physical symptoms include backache, postural problems, dried and strained eyes, sleep disturbances, profound weight loss or gain. Various risk factors identified for internet addiction include loneliness, stress, anxiety, depression, history of any other addiction, lack of social support, etc. The treatment for this addiction focuses on counseling targeting interpersonal issues, support groups, building stress coping strategies, etc. 4.2.5 Work addiction, often referred to as workaholism, manifests as an intense persistent need to engage in work. The individual may not necessarily occupy own self with work out of any monetary or success rewards but rather psychological need to work. It may also be viewed as a compulsive behavior to counteract the obsession with work to an extent that person develops anxiety when he/she is not working. As a consequence, they tend to keep working irrespective of the nature of work and its quality. Many times it has been seen that work addicts tend to lose their job as they do not focus on a particular task and keep shifting with other sets of work. A work addict generally denies that he suffers with a problem but rather accepts it as job pressure or ambition to grow professionally. The common symptoms of addiction include persistent preoccupation with work, constant inability to remain calm and relaxed, work in spite of excessive fatigue or ill health, strong inability to trust subordinates for work, no space for rest or time to eat. The effects of work addiction are quite serious. Significant loss to physical health is commonly seen with addicts. Loss of interpersonal relationships emerges as the addict is not able to give quality and quantity of time to it. Emotional effects such as low mood, irritability, guilt, frustration, anxiety take a role. Stress appears to be the most common effect as addict seems to be stressed out always of the unfinished tasks and the next task to be accomplished. The treatment on this type of addiction includes use of medication to treat anxiety is similar to obsessive compulsive thought pattern and cognitive behavioral therapy to challenge the underlying causes of low self-esteem and self-worth. 4.2.6 Exercise addiction. This type of addiction is commonly associated with the increase in the cosmetological appeal. It entails excessive or compulsive exercising which may also prove hazardous for physical and psychological health of the individual. The identifying feature of this type of addiction is persistent preoccupation with the mental content of exercising. Also, the inability to concentrate anywhere else emerges as a significant sign. Many addicts tend to pay a heavy cost for exercising in terms of financial debts, poor work performance and irregularity at work. Significant loss of personal relationships and poor social performance as a result of excessive time spent in exercising is another common symptom. Inability to exercise with others manifested as an affective disturbance in the own exercising regime also marks it as different from regular or non-compulsive exercising. Comorbidity with eating disorders such as anorexia nervosa or bulimia nervosa is very closely observed with such addicts to an extent that many times this addiction is also referred to as anorexia athletic. The effects of such addiction have serious consequences on the physical and psychological health of the addict. Some of the serious physical effects include excessive fatigue, sleep disturbances, joint damage, stiffness in muscles, loss of muscular weight, reduced bone density and irregular menstrual cycle in women. The psychological effects include cognitive errors, attention and memory biases, increase in anxiety if not able to exercise, low mood, body image disturbance and low self-esteem. The treatment for Psychology paper number 1, Cognitive Science. This type of addiction does not include use of prescription drugs but rather psychotherapy aiming to deal with underlying strong issues of poor body percept, low self-esteem, anxiety and interpersonal conflicts. Family support is viewed to be a strong predictor of prognosis with this unique addiction. 4.2.7 Gaming addiction. A special focus on video gaming addiction has been not recognized as a mental illness by American Psychological Association. However, its symptoms and effects have been observed quite similar to work or sex addiction. One of the key features of addiction is the increase in threshold of satisfaction after playing. This threshold seems to keep increasing and the individual tend to play more and more to achieve the level of satisfaction. Increased arousal, irritability and anxiety in situations where one is unable to play has been observed as an important symptom. Preoccupation with the idea of gaming and no track of time invested lies at the epicenter of the addiction. The other common symptoms include sleep disturbances, loss of interpersonal relationships, lack of social interest, sudden significant weight gain or loss, poor academic or work performance, mood swings, etc. Such kind of addiction seems to seriously affect the physical health in terms of causing excessive fatigue, neurological problems, numbness in hands and feet, postural problems, etc. The psychological effects include cognitive deficits, poor judgment, slowness in information processing, forgetfulness, increase in violent behavior as a result of playing violent games, inability to concentrate, avoidance of family and friends. The treatment involves counseling and behavior modification to target underlying anxiety, substituting it with constructing behavior, and enhancing the ability to deal with stress. 4.2.8 Shopping addiction. Shopping is considered to be his favorite pastime especially for women but many times it tends to become pathological. As also commonly referred to as shopaholic, the individual engages in persistent shopping despite of serious negative consequences. Since it also conforms to the societal norms and is considered to be a sign of prosperity, hence it becomes difficult to identify it as addiction. It manifests itself as any other addiction where the person seems to get preoccupied with the thought of shopping and is unable to control despite of significant losses. The feeling of helplessness, where the addict knows that it is wrong but still continues to exhibit shopping behavior, creates a lot of stress on the addict. The other symptoms include shopping of items which are not required, shopping even when in financial debts, hiding shopping activates, manipulating bills and accounts, feeling of lowness when not able to shop or after shopping, constant conflict with family over the issues of spending more than required, etc. Shopping is believed to have a pleasantry effect and perhaps gives an emotional boost to the addict. Perfectionism, depression, anxiety may fuel the damaging behavior. The effects of addiction involve significant financial debts, poor health, at times hoarding of items which are not required, low self-esteem, poor interpersonal relationships, avoiding social engagements because of time given to shopping, etc. The treatment involves intense counseling and psychotherapy to deal with underlying tough emotions. A significant difference in treatment of this addiction is that complete abstinence like in alcohol or drug addiction can't be achieved as shopping is an integral part of life. However, with treatment the addict may learn the art of shopping and may not use it as a compensatory or escaping behavior to deal with intense emotional conflicts. Psychology paper number 1, Cognitive Science. 5. Summary. Addiction can be defined as primary chronic disorder of brain reward, motivation of the circuitry system. Disruptions in such areas may lead to psycho-socio-spiritual disturbances which may clinically affect the adaptation of the individual. The process of addiction in the brain starts with disturbed interaction among the nucleus accumbens, basal forebrain, anterior cingulate cortex and amygdala. Addictive behavior is typified with symptoms such as inability to persistently abstain, lack of behavioral control, loss of interpersonal and occupational functioning, increased craving for the substance and an inappropriate emotional response. Addiction can be classified as substance addiction and behavioral addiction. Substance addiction includes substance-related disorders which can further be categorized as substance dependence or substance abuse disorders. Behavioral addiction includes addiction towards a behavioral response such as gambling, gaming, shopping, sex, etc. Various daily life substances that can cause addiction can be classified into stimulants, depressants, hallucinogens, and inhalants. Stimulants produce physical and cognitive stimulation or arousal to the human. The short-term effect of stimulant increases alertness, attention, blood pressure, pulse, and respiration. Daily life stimulants causing addiction are alcohol, caffeine, nicotine, and cocaine. Depressants or tranquilizers work opposite of the stimulants and produce inhibitory and relaxing effects in the brain. Common depressants used are benzodiazepine, barbiturates, and heroin. Hallucinogens are extracts of plants which contain nitrogen classified under alkaloids that resemble the structure of original neurotransmitters such as serotonin, acetylcholine. They carry the capacity to produce hallucinogenic and psychedelic effects. Common hallucinogens used are ecstasy, LSD, and PCP. Inhalants include wide variety of substances such as solvents, gases, aerosols, nitrites which are consumed only through inhalation or snorting with the nose. Various daily life substances such as paints, fluids, petrol are generally inhaled. Abuse of inhalants involves euphoria, dizziness, slurred speech, poor psychomotor coordination, hallucinations, delusions, etc. Behavioral addiction is different than substance addiction in a way that no substance is ingested by the body. However, the person gets addicted to certain set of behavioral responses. Symptoms of behavioral addiction may involve persistent uncontrollable impulse to engage in specified behavior, increasing anxiety before the initiation of behavior, relief after engaging in behavior, a sense of uncontrollability and inability to stop the behavior. Psychology paper number 1, Cognitive Science. Subject Psychology. 2. Introduction. In the previous modules, we have been acquainted with the concept of addiction, daily life substances used for addiction and various approaches in terms of models that have been used to explain the addictive behavior. In the present module, we will focus specifically on the cognitive effects produced by addiction. The text will emphasize on the role of cognition in causing addiction and how in turn, cognition is affected as a result of chronic addiction. Hence, the cause and effect vicious cycle of addiction is highlighted in the present text. Also, the learners will be able to differentiate the effects of drugs on separate cognitive faculties such as memory, executive functions, etc. The effect of exposure to drugs at different periods such as prenatal exposure, adolescent exposure, and geriatric impact is mentioned in the text. The potential ability of drug addiction that leads to other physical and psychological disorders is also attended in the text. The development of substance-induced disorders such as depression, anxiety, personality disorders, psychotic disorders have also been addressed. 3. Cognition and addiction, a link. Addiction since long has been viewed as a disorder exhibiting traits of compulsive behavior. The obsession with drug and resultant compulsive act of acquiring drug anyhow, abusing it to reduce craving, dealing with anxiety in case of absence of drug, all seem to mimic behavior of obsessive-compulsive disorder. However, the recent work on addiction Gould, 2010, has developed a new perspective to view it as a pathology arising from altered cognition. Literature reveals that brain areas involved in process of addiction like hippocampus, amygdala, prefrontal cortex, control major cognitive functions such as learning, memory, perception, etc., which reinforces the addiction cycle. The continued use of addictive substances changes the normal of the functioning of these regions and produces cognitive transitions that maintain the addictive cycle. Addiction has also been viewed as incorrect SR learning, where the individual may develop pathological connections between the drug and environmental conditions that may promote addictive behavior. The chronic use of drug then may produce cognitive errors or deficits which may obstruct the ability of the individual to achieve complete abstinence. Addiction has been viewed as a multi-stage process. It occurs in 2 stages where at the first stage, individual social drinking turns into pathological drinking and alters the circuitry reward system of the brain. Such changes produce pleasurable effects in the brain and encourage the individual to engage in satisfying pleasurable impulsive activities such as eating or sex. At the second stage, the addictive process begins to crystallize and individual starts depicting clinically. Psychology paper number 1, Cognitive Science. Significant pathological symptoms such as withdrawal signs, inability to achieve abstinence, greater chances of relapse. Cognitive deficits such as impaired judgment, attentional biases, etc. Therefore, the initial stage marks the formation of pathological drug-stimulus associations that reinforce the drug use, and the later stage introduces changes in the cognitive processes that support the cognitive cycle and inhibit process of abstinence. Hence, control at the first stage may have better prognosis than attempts of correction at the second stage. 4. Cognitive effects of addiction. 4.1 Formation of stimulus-drug association. It has been widely observed that chances of relapse are extremely high for substance abuse and addiction as a result of strong maladaptive connections made between substance and the environment. These environmental cues trigger the mental associations and serve as strong precursors to the addictive behavior. Encounter with situational cues such as specific place of drinking or company or glass creates intense craving and urges the individual to engage and re-engage in the process of addiction. Exposure to such prompts introduces strong physiological response in the individual and at the same time produces changes in the brain activities controlling executive functions. This phenomena is called conditioned place preference and has been well depicted in use of various drugs such as nicotine, cocaine, amphetamine, etc. The research on various laboratory animals such as rats has also confirmed the phenomena where the use of drug in one compartment of the cage elicits a physiological response of craving when brought back to the same cage. The association exhibits the process of classical conditioning where the cage or place acts as conditioned stimulus and acquires the capacity to biologically elicit the response of craving even in the absence of the unconditional stimulus, i.e. drug or alcohol. Such maladaptive learning prevents relapse and restarts the chain of addiction. As a result, complete abstinence to be achieved is a challenge. Hence, it also warrants the intervention programs to include clear instructions to the significant others of the addict to avoid encounter with any of such strong environmental cues, like for instance, in case of alcohol addiction, after abstinence, the family of the patient is instructed to remove the glasses of alcohol and not to use any fragrance which may have alcohol in it, as it may act as a trigger to the strong cravings and initiate the cycle of addiction. 4.2 Persistence of stimulus-drug association. The persistence of this stimulus-drug association has been found to underlie the process of addiction. Also, the chronic use of various drugs have been observed to influence the association and prevent relapse. Researches depict that the addictive substances work on the communication pathways or synaptic connections between neurons to form and maintain the stimulus-drug association. Studies have further suggested that proteins that are involved in these synaptic connections are also involved in drug-seeking behavior, and hence as a result the addiction cycle is continued, which prevents relapse. The drugs work in two ways with the synaptic connections, i.e. strengthening of neural connections by long-term potentiation and inhibition of neural connection. Psychology paper number 1, Cognitive Science. Called long-term depression. Each of the drug exhibits either excitation or inhibition of the synaptic pathways to maintain the addiction cycle. The table below represents the functioning of the major drugs on the synaptic plasticity. Drug effects on plasticity. Amphetamine LTP, cocaine LTP, ethanol LTP, limited marijuana LTP, limited morphine LTP, nicotine LTP. Fig 1. Representing the effect of various drugs on synaptic plasticity. 4.3 Impact of drug abuse on executive functions. Considerable amount of literature has been available to document the harsh effects of substance abuse on cognitive functioning. Glass et al., 2009, Lober et al., 2009. One of the most common symptoms that emerge as a result of alcohol addiction is Wernicke's-Korsakoff syndrome, WEAKS. The syndrome primarily manifests with alterations in memory function and poor emotional control, however preserving the intellectual functioning. With its debilitating effects on memory, it is also included in DSM-IV as alcohol-induced dementia. In case of other substances, commonly, decline in attention and memory have been found. In case of depressants, fall in psychomotor speed, temporal ordering and recent memory are generally viewed. Various stimulants have been observed to produce deficits in cognitive flexibility, working memory and attention. Depressants produce inhibitions in central nervous system and lead to drowsiness, increased inhibitions, slowness, sleep, etc. They also tend to slow the brain process, alter perception, produces attention and memory deficits, fatigue, heart rate, etc. On the other hand, abuse of hallucinogen drugs such as LSD, PCP, etc. lead to perceptual distortions, emotional irregularities, cognitive deficits, and physical damage. Another substance addiction observed most commonly in children and addicts is abuse of inhalants such as nail polish, glue, eraser, etc. Chief signs of inhalant abuse include euphoria, dizziness, slurred speech, poor psychomotor coordination, hallucinations, delusions, etc. Its chronic use may result in poor inhibitory control, confusion, drowsiness, nausea, etc. In case of behavioral addictions such as gambling, food, sex, internet, persistent preoccupation with the mental content and performance of compulsive behavior emerge as major cognitive behavioral effects. Poor impulse control, feeling of helplessness, impaired judgment, biases and information processing emerge as central cognitive features in initiating and maintaining the addictive behavior. Psychology paper number 1, Cognitive Science. 4.4 Cognitive effects produced by specific substances. There are various substances such as stimulants, depressants, hallucinogens that lead to different effects on cognitive and social well-being of the individual. Each of the substance may initially improve the cognitive functioning and emotional well-being, but with its chronic use it may reduce the quality and well-being of cognitive and emotional functions. Some of the important substances used regularly have been listed as follows. Nicotine. Nicotine dependence syndrome is observed widely and majorly amongst adolescents. It is found in items such as cigarettes, chewing tobacco, and cigars. The cognitive effects of chronic addiction to nicotine involve strong craving for substance, irritability, frustration or anger, anxiety, difficulty concentrating, poor implicit memory, restlessness, decreased heart rate, and increased appetite or weight gain. The withdrawal symptoms include headaches, decreased metabolic rates, tremors, impairment of performance, etc. Cocaine. Widely used as a stimulant, chronic addiction of the same involves serious cognitive deficits. Memory deficits have been observed in various neuropsychological studies. Beatty et al., 1995, Bull et al., 1999. Poor immediate verbal recall, recognition, and diminished working memory capacity emerge as significant memory impairments. Studies have implicated role of cocaine in inhibiting the generation of new hippocampus cells and thus reduce the functioning of the working memory. Sudai et al., 2011. Deficiencies in learning and memory have also been in cocaine patients even after remission. Fox et al., 2009. Amphetamine. The psychostimulant drug has been observed to enhance cognition in hyperactivity disorder and other neuropsychiatric disorders. It has also been viewed to improve cognitive abilities in healthy control subjects. However, its chronic use has been associated with significant impairments in cognitive functioning. Poor performance on various cognitive tests have been viewed as a result of cocaine abuse. Impairments in memory have emerged as the most significant cognitive deficit, along with reduced attention span, which could be attributed to the reduced neurogenesis of the brain and disruption of the blood-brain barrier. Silva et al., 2010. Ecstasy. This widely available illegal drug in the category of hallucinogens is not for clinical use. The chronic use of this psychotropic drug is viewed to selective and persistent damage to central serotonergic nerve terminals, impacting the areas of memory and learning. This reduced activity in serotonergic AMD dopaminergic is believed to cause serious alteration in perception, hallucinations, mood, and memory impairments. Decreased working efficiency, reduced appetite, sleep disturbances, and diminished well-being emerge as important psychiatric deficits. Poor performance on tasks of contextual memory, spatial memory, working memory, set shifting, and cognitive flexibility is observed as a result of persistent abuse of the substance. Opioids. The versions of opiates such as heroin or morphine have depicted to result major cognitive decline. The illegal drug is observed to produce attention deficits and memory impairments. The effects manifest in reducing pain sensitivity and producing significant impairments in learning and memory. The drug works by altering the functioning of hippocampus. Psychology paper number 1, Cognitive Science. And prefrontal cortex. Also, it inhibits the neurogenesis contributing to serious cognitive deficits. Ornstein et al., 2000, Young et al., 2009. Barbiturates. These medicines were initially used by doctors to produce relaxation and improve sleep disturbances. But with the heightened use of the drug, they realized that it produces effects similar as coma or death. Since then, the use of the drug was restrained and was replaced by benzodiazepine. The drug works by enhancing the functioning of inhibitory neurotransmitter GABA, which then relaxes the brain and calms the body. The symptoms of addiction include tolerance, impaired judgment, confusion dependence, psychosis, blurred vision, slurry speech, hypotension, poor motor coordination, irritability, depressive mood, respiratory problems, etc. The long-term effects of the drug include interpersonal relationship problems, seizures, attention and memory deficits, coma, liver disorders, heart problems, and death. The withdrawal symptoms include delirium, convulsions, irritation, anxiety, sleep disturbances, hallucinations, general weakness, etc. 4.5 Prenatal exposure to substance abuse. Prenatal period is believed to be the foundation stone of the human life. The development of brain during this period is a continuous process and is extremely vulnerable to any type of injury, trauma, or harsh exposure such as alcohol or drugs. This vulnerability is not restricted only to the prenatal period but also extends throughout adolescence. Such exposures may seriously affect the normal development of the brain and may predispose the child to various physical and psychological abnormalities. Prenatal exposure to alcohol may produce grave effects such as mental retardation or greater susceptibility to other substance addiction is included in fetal alcohol spectrum disorders. This spectrum of disorder is viewed to be most common cause of mental retardant and other psychiatric abnormalities in America and other developed nations as well. There is no dearth of literature to confirm deleterious effects of substance abuse in the prenatal period. In one research, the children of alcohol and drug-abused mothers were compared with normal healthy controls. Pulsipher et al., 2008. The results revealed significant deficits in children of exposed mothers in the area of language, articulation, impulsivity, and visual attention span. However, the two groups did not vary on the parameters of intelligence, manual dexterity, or sustained attention. Another analogous study validated memory and attention deficits in children with mothers who were exposed to marijuana or alcohol during pregnancy in comparison to children of non-drug exposed mothers. Richardson et al., 2002. Prenatal exposure to stimulant drug called methamphetamine was highly correlated with cognitive deficits and altered brain formations. The children with prenatal exposure to such drugs were found to exhibit memory deficits in terms of long-term memory, spatial memory, and visual motor coordination. Changes were observed in the brain structure of parietal cortex and frontal cortex of young toddlers whose mothers were exposed to the psychostimulant Cloak et al., 2009. Similar effects were also viewed in laboratory experiments on pregnant rats. The expecting mothers were exposed to methamphetamine and the babies were found to be deficient in spatial memory. Slamberova et al., 2005. The effects of prenatal nicotine exposure is as debilitating as any other drug but exhibits greater concern due to high prevalence of tobacco consumption amongst women. The prenatal effect of Psychology paper number 1, Cognitive Science. Tobacco has been well correlated in children with changes in hippocampal and parahippocampal areas. Jacobson et al., 2006. The studies also confirmed reduced cortical thickness and structural changes of white cortical matter in children with prenatal exposure to tobacco in comparison with healthy controls. Toro et al., 2008. The prenatal exposure to tobacco has been observed to lead to lower grades of intelligence and attention deficit hyperactivity symptoms in exposed children in comparison to non-exposed children. The results of various studies have confirmed a difference of as much as 12 point in full-scale IQ of prenatally exposed children and non-exposed children. The probability of acquiring ADHD was 3 times higher in children with prenatal exposure to addictive substances. Watkinson and Gray, 2003, Polly and Stotkin, 2008. Similar results of harsh nicotine exposure have also been viewed in rats where it was related with reduced memory-related neural activity and changes in hippocampal area with both male and female rat babies. However, these deficits seem to persist only in the male rats in later adulthood. Baglanova et al., 2008. Nevertheless, the cognitive deficits as a result of prenatal substance abuse seem to be grave in both humans and animals. The most serious effect that emerges is that it predisposes the fetus to later life addiction. However, it may not ascertain any specific substance addiction. This then may follow in further generations and may create a vicious cycle of addiction. Hence, it seriously warrants expectant mothers to avoid any kind of substance abuse in order to protect the fetus from prenatal damage and break the vicious cycle of addiction. 4.6 Adolescent exposure to addictive substances. Adolescence is the most delicate period for acquisition of any type of addiction. Majorly attributed to peer pressure, family exposure, societal and cultural norms, the process of addiction begins at adolescence and continues till later life. It has been observed to have debilitating effects on cognitive abilities such as learning, memory, attention. The most common substance of addiction during adolescence is nicotine, which is observed to have serious effects on cognition. Various studies in both humans and animals have confirmed the same. One study reported poor performance of adolescent smokers on tests of working and auditory memory, verbal comprehension, and mental mathematics. However, most of the deficits seem to fade with termination of smoking, but deficits of working memory and oral mathematics seem to prevail till later adulthood. Fried, Watkinson and Gray, 2006, Jacobson et al., 2005. Even in rats, adolescent exposure to nicotine has been well correlated with poor visuospatial abilities, impulsivity, attention deficits, and alterations in the medial prefrontal cortex. Kunad et al., 2009. Various evidences have confirmed deficits in learning and memory of rats treated with nicotine. Some researchers have also demonstrated initial cognitive enhancement with use of nicotine but later major cognitive decline with its abuse and tolerance developed by the body. Kinney and Gould, 2008. Nicotine abuse has also been found to lead to various other disorders in later adulthood such as depression or stress-related disorders which act as further reinforces to the process of nicotine addiction. Abuse of various other substances such as stimulants, hallucinogens have also been found to lead to various cognitive deficits of memory, attention and learning. O'Shea, McGregor and Mallet, 2006, Brown et al., 2000. Thus exposure to such substances in adolescence should be controlled and underlying factors should be appropriately treated. Psychology paper number 1, Cognitive Science. 4.7 Substance abuse leading to other disorders. Abuse of drugs may cause serious cognitive deficits, and at the same time people with mental illness tend to abuse drugs at the most. As a result, drug abuse becomes a cause and effect of acquisition and maintenance of mental disorders. Smoking and schizophrenia have been observed to exhibit high comorbidity. The symptoms of schizophrenia cause serious cognitive deficits in areas of visuomotor coordination, intelligence, impulsivity, perceptual distortions, etc., and its comorbidity with nicotine causes further cognitive decline. Nicotine abuse has been observed to increase the occurrence of schizophrenia specifically in patients who are predisposed to develop the disorder. Zedonis et al., 1994. In some other cases, it has also been found that patients of schizophrenia tend to smoke more as a result of side effect of antipsychotic medications. McEvoy et al., 1995. Further, in certain cases, they use smoking to enhance their capacity to deal with tough symptoms of psychotic pathology. Drug abuse in early childhood or with prenatal exposure has also been associated with attention deficit hyperactivity disorder, ADHD. Connors et al., 1999. As in case of schizophrenia, nicotine is also at times used to reverse the symptoms of hyperactivity, which in turn may also act as a catalyst to the maintenance of the disorder. Besides nicotine, other psychoactive substances such as stimulants, psychotropic drugs, hallucinogens have also found to alleviate ADHD symptoms. During intoxication, drug abuse is also associated with precipitation of various substance-induced disorders such as delirium, anxiety, amnesia, depression, etc. Learning disability exhibition problems in the areas of reading, writing have been found to occur as a result of drug abuse. Problems in the areas of problem solving, decision making, following instructions are also manifestations of substance abuse. Personality disorders such as paranoid, narcissistic, borderline disorders have also been closely associated as both cause and effect of the drug abuse. Depression and bipolar disorder and post-traumatic stress disorder may precipitate as residual effects after abstinence. In case of geriatric population, higher sensitivity to toxic effect of the drugs on the brain is viewed. Also at the same time, they tend to be more vulnerable to cognitive impairments such as dementia or amnesia as a result of drug abuse. Thus the use of drugs not only causes physical harm but very serious psychological damage across periods of development. Be it prenatal period, adult life or old age, substance abuse has been well associated with cognitive decline. As the acquisition, the treatment of addictive behavior is equally complex and multifarious. It has to target the period of acquisition, type of drug abused, reinforcing factors of addiction, dealing with withdrawal symptoms, county morbidity of other pathologies, etc. Hence each intervention module has to be completely customized in order to be effective. 5. Summary. Addiction is viewed as a pathology arising from altered cognition. Specific brain areas involved in process of addiction like hippocampus, amygdala, prefrontal cortex, control major cognitive functions such as learning, memory, perception, etc. The addiction cycle focuses on changes in cognitive processes as a result of substance abuse, and parallel maintenance of addictive behavior as a consequence of changes in the cognitive abilities. Psychology paper number 1, Cognitive Science. Addiction can also be seen as maladaptive stimulus response association, where the individual may develop pathological connections between the drug and environmental conditions that may promote addictive behavior. Addiction occurs in 2 stages. At the initial stage, stimulus-drug association is formed, and at the later stage, changes in the cognitive processes that facilitate addictive behavior are introduced. The second stage inhibits the process of withdrawal and reinforces the addictive cycle. Therefore, control at the first stage may have better prognosis than attempts of correction at the second stage. Maladaptive stimulus-drug associations such as environmental cues serve as strong precursors to addictive behavior. The persistence of stimulus-drug association has been attributed to synaptic plasticity exhibited by various drugs. Drug abuse has been related with serious cognitive impairments such as attention, memory deficits, difficulties in problem solving, decision making, impaired judgment, mood instability, impulsivity, etc. Substance abuse during prenatal period produces deleterious effects such as mental retardation, ADHD, learning disability in the developing brain of the fetus. Adolescent exposure to drug is primarily attributed to peer pressure, family exposure, societal and cultural norms. It produces debilitating effects on cognitive abilities such as learning, memory, attention, judgment, etc. Chronic drug abuse has been found to lead to various other psychopathologies such as schizophrenia, personality disorders, ADHD, learning disabilities, mood disorders, etc.